Investing in the community is an evolution in terms of delivering healthcare. You are defining yourself as a key bit of the community's infrastructure, just like the water system, just like the power system. So this project began 4 years ago, looking simply at a need to replace the hospital. The more that program started to develop, it had to start to have more direct community impacts beyond just what was on this campus. We now know more about what makes an individual healthy than we probably ever have before.
We know as healthcare providers that in order to provide really quality care, it can't be just about fixing people's problems inside the four walls of the hospital. That's really important to be out in the community and trying to find issues where the built environment is impacting people's health as well.
Making sure people have access to transportation to get from place to place, not just to a hospital or healthcare. Have access to education. Have access to open space for play and for activities.
Making sure that there's a sense of safety and security in the neighborhood. What we're going to be doing is a development project at the Lincoln building. It's a former theater that we purchased where we'll be locating the MetroHealth Police Department to bring that sense of safety and security to the neighborhood. So we made a $4 million investment in partnership with RTA to improve the buses, to provide better bus shelters for neighborhood and residents. We partnered with Metro West Community Development Corporation and several key financial institutions to provide a low-income housing tax credit project that provided over 36 affordable units in the neighborhood.
I think the relationship between a community development organization and an anchor institutions like MetroHealth is incredibly important. Together we can work together to affect real change in the neighborhood, and we can create positive outcomes like Lofts Lion Mills.
You know, we provide health care and that's what we know, but it's really important that we understand some of the other community aspects as well. We're really learning and listening and understanding what the needs of the community are as it relates to the built environment.
It's important for MetroHealth to have a relationship with our residents to build trust. They need to be part of the transformation. They need to be part of the plan.
We are a public healthcare organization. By definition, we can't help it but be an investor in the community. But beyond that, it simply makes good sense. It's not about when you arrive at the front door of a hospital necessarily. It's how that institution can work with the community in a much broader way to start to make this a vibrant community, which is also then a healthy community.